everyone, and welcome back to another episode of Diabuddy Dialogue, a podcast by the Diabetes Hope Foundation EDI Committee. I'm Afreen, and I'm here with my co-host Aastha. Today, we're going to be talking about something that we feel isn't talked about enough, and that's maternal health and type 1 diabetes.
Yeah, there's so much nuance when it comes to navigating pregnancy and motherhood with T1D. Decisions about care, tech, access, and how your body and your identity are treated, not to mention your baby as well.
We're so lucky to be joined by someone who has seen all this firsthand. Rukia is a mother, a first-generation Canadian, and an engineer working in the medical device field. She was diagnosed with type 1 diabetes at 14, so she brings lived experience from so many different angles, from being a teenager, a young adult, a professional, and as a new mom as well.
She's also a strong advocate for equity and access in diabetes care across Canada. So we're very excited for this one. Rukaya, welcome to Diabuddy Dialogue.
Thank you so much for having me. I'm very excited about this. Yeah, my name is Ruqayya, and so I was born in Khartoum, Sudan, and I grew up in a small country in the Gulf called Oman. I moved to Canada when I was 22 years old to pursue my master's at McGill University in engineering, and after that, I basically stayed in Canada. I worked for a few companies in the medical device field, and today I continue working in medical device regulations. As you mentioned, I'm a mother of two daughters, both under 4 years old, and I'm a type 1 diabetic. I've been diagnosed with type 1 diabetes at the age of 14. And so I have lived, through my, adolescence as well as young adulthood and motherhood with diabetes. And I'm here to share my experience as a mother. My pregnancy experience with type 1 diabetes. I've gone through two pregnancies, and basically, I'm here to share the ups and downs, what I learned about access to technology, and I also bring a message of how we can make it better, how we can make it easier for a woman with type 1 diabetes and who are going through pregnancy, how we can improve access to them, and as well as how, even if you're not going through pregnancy right now, how you can advocate for better care and better access.
That is amazing. Once again, we are so lucky to have you, and thank you so much for giving that little bit of an intro of yourself. I guess to kind of like kickstart things, could you tell us a little bit more about your journey with T1D? Like, what was it like? What was your diagnosis like at 14? How did it change or transition into adulthood and eventually as you became a mom?
Yeah, for sure. So both of my parents have diabetes. So that helped in terms of diagnosis, in terms of picking up signs, early signs for type 1 diabetes. I will also mention my brother has type 1 diabetes and he's older than me, so he was diagnosed prior to me. So when I was 14, I basically had some of the typical symptoms of type 1 diabetes, which is, frequent urination. I fainted once at school. And I told my parents about that, so they immediately, it was immediately a red flag, and they thought that they should take me to an endocrinologist, the family endocrinologist, to check my A1C level, and my A1C level was very high. So that was my diagnosis story. In terms of medications at that point, so I was living in Oman. And insulin pumps were it was a very novel technology. It was very new in the country. There are not many pharmacies that carried the supplies. It was also quite expensive. So I was given, injections. And at 14 years old, I learned how to inject insulin and check my sugar levels. So basically, between the age of 14 and 24, 25, I was injecting myself with insulin around 3 times a day. So yeah, it was. Of course, there are ups and downs. I struggled at the beginning controlling my sugar levels. As I was, I was young. I wanted to, experience a normal I don't know, and I just want to have a normal life. I wanted to eat what everyone else was eating, my peers at school. So it wasn't easy at the beginning. So yeah, it was all I can describe it by is that it was like a roller coaster, just a lot of ups and downs, and me just trying to do better. Um, my A1C went down. It was okay, but it wasn't. I would say I have to say it wasn't the best. But yeah, I had supportive parents who encouraged me to eat well. Encouraged me to take my insulin on time. So yeah, and I after 18 years old, I was living by myself in university, and then I moved here to Canada for my master's.
It's so interesting how, everyone's experience is so different depending on where they're from or, what kind of access to things they had or, their family situation. So thank you for sharing that. We're also wondering what really sparked your passion for maternal health and type 1 diabetes. Was there something about your own pregnancy experience that maybe made it feel personal or urgent?
Yeah, that's a good question. So when I was pregnant with my first daughter, I didn't have access to a CGM or an insulin pump, and that's because they were expensive and they were not covered in the province where I lived. So and at the same time, I don't believe my private insurance covered it. Um, so I was very scared. I I I knew about all of this technology, but I didn't have access to it. And when my baby was born, my first daughter, her sugars were very low when she was born, and they had to put her in the NICU for I think 2 days. And it was a very scary time for me and my husband. She was also born overweight. She is, she grew so much in the womb, and she struggled basically to follow the normal curve when she was born, the normal growth curve. Um, so it was a very scary time. And with my second daughter, I was able to get a CGM and an insulin pump, and I can tell you the outcome was very different. My daughter was born with a normal weight. She spent no time in the NICU. We were basically out of the hospital the next day, which was amazing. I couldn't believe it when my daughter was born. I couldn't believe her size. I thought it was too little because from my own experience, it was only my first daughter and she was huge. So I'm very glad that it went well. And I really wish that my first daughter, when I had my first daughter, I had the access to an insulin pump. Um, there are also a lot of changes that happen during pregnancy um, that I think we need to be better informed about. For example, when you talk about pregnancy planning for women who have type 1 diabetes, they need to be taking prenatal vitamins. They need to have their A1C below 6, which is a lot tighter than the normal range, which is basically below 7. The normal recommendation is below 7, but if you're trying to become pregnant, then it's below 6, and that's basically to ensure that the initial growth of the baby is healthy and they don't have any genetic issues or abnormalities in that first month. So, and then you have the basically the first trimester, first and second trimester, which were again it was a roller coaster with both pregnancies, but I think and I feel that it was better controlled with the second one, because with the CGM and the pump, you have real time access to the data. You have real time access to your blood sugar levels, and you're able to correct it. Also in real time, and or the system, if it's closed loop, then it's able to correct it for you, so you end up being in range in that basically 6.3, 6.4 and below numbers a lot longer. So it was very helpful. So in my first trimester, there were a lot of incidents of hypoglycemia, which I think is the case with a lot of women with type 1 diabetes. And then basically in the second the end of the second and the third trimester, you end up having a lot of hyperglycemia because of the insulin resistance. It basically you have a lot of insulin resistance during that time, so you need a lot more insulin to keep your numbers down. Um, so all of that, I think, you, women with type 1 diabetes need access to a care team who's aware of all of this and is able to give them advice. And is also, it has a lot of empathy and understands that it's not easy. It's not an easy journey. So yeah, all of that basically sparked my interest about this, about access and about the importance of having a great healthcare team, about information availability. So yeah, that's what sparked my interest, and I think having access is a big issue around the world and in Canada as well. So I think that every woman with type 1 diabetes should have access free of cost to the latest technology. So having a CGM and insulin pump that can measure the sugar level and basically in real time correct her sugar level will help the woman have a better outcome for both themselves and for their babies, and will reduce the time spent in the NICU.
Yeah, hearing that, it reminds me how important access is because I think like sometimes we think about that word and think it doesn't make a big difference in people's lives, but hearing the difference that you experience between your first pregnancy and your second pregnancy kind of grounds why advocacy around access is so important. So like I was wondering like you took a lot of like differences like medically and physically between your first pregnancy and your second pregnancy. How did this affect you emotionally? Like what was the difference? Like how did access to care help you in that state, like in an emotional state?
I'm very grateful for the access I had with my second daughter. Um, and I think every woman deserves this. Every woman, especially in Canada, when when people hear about Canada, they think immediately, free healthcare, everything is covered. Um, but I think this needs to be highlighted. I think, and I think in a lot of provinces, there is coverage, but it's not free of charge. And all of these supplies are very expensive. Especially talking about insulin pump supplies. Of course, insulin is covered, and you have a lot of private insurance companies. They cover the cost for the pump, but then every month you have to pay for the insulin pump supplies, which basically can be around $600 every month, and that's not um, insignificant. Um, so I think we need to have better resources in terms of comparison of the cost. Like what is the amount that you need to pay out of pocket? That information should be available online to women who are have type 1 diabetes and considering getting pregnant, and they want to invest in an insulin pump. And I think ultimately we should make all of these supplies free of charge, and not basically make them dependent on private insurance companies and basically health insurance that is linked to your employer. And there I know that there are some efforts, there are some advocacy efforts in the parliament with regards to access. For example, pharmacare. With pharmacare, it's basically an act to make sure that essential medication is free of charge, and that includes diabetes medications. But right now, insulin pump supplies are not included in that list, and I believe that the scope should be expanded to include insulin pump supplies. And I believe that more provinces should try to sign into this act. So I believe now it's only a couple provinces that have signed into this act.
Yeah, you're absolutely right. Like when I'm thinking about like access, it's like we want it so that everyone has access to it. Like we want to limit as many barriers as we can. From my perspective, like as someone who's never really thought about pregnancy, I've never really considered how my diabetes will one day affect my ability to have children. And so like for me, part of the gap is also just in like understanding. Like, do you ever find like that's a gap in like T1D and pregnancy as well, where like you went into your pregnancy maybe not knowing of like certain complications that might come up or how your T1D management will affect like the child of your baby, the life of your child, I'm sorry.
Absolutely. It was basically learn as you go. With both my first and second. I think in my second, I learned new things that I wasn't even aware of, and with my first. But yeah, absolutely. I think there's a lot to learn. There are a lot of fluctuations, a lot of things that happen that you don't understand why they're happening. For example, like the first and second trimester, you having hypo, still the same person, you're following the same diet, but all out, all of a sudden your sugars are low, and you can't explain them other than the fact that you're pregnant, and that's basically affecting your body, and it's basically you need to adjust your numbers, you need to adjust how you eat, the insulin that you're giving yourself, like basically the settings on your insulin pump, which again changes basically week 16 and above of your pregnancy. So you need to stay on top of these numbers, you'll need to stay on top of these charts of the CGM, and be in close contact with your endocrinologist, basically see them weekly and change those settings as you go. So there are a lot of changes, and it's a very stressful time. It's one of the I think one of the hardest things that I've ever done in terms of my health. And there are a lot of emotions involved. It's because it's not only about yourself; it's also about this life that you're growing, and then knowing that all of those decisions will affect them. It will affect their health, their growth, long term. So yeah, it's not easy, and I think with this technology, we can make it easier. And it's proven. There are many studies out there that show that having access to a CGM or an insulin pump can significantly reduce complications, whether it was for the mother or for the baby, including NICU time, which I think is can be very stressful for mothers when they're just gave birth and their baby's not with them. It's in the intensive care unit, and their sugars are low. And there's so many emotions as well with postpartum. You're not sleeping, maybe you just had a surgery, and your priority is no longer yourself, but it's your baby. So that also their sugars are not the best at that time as well. I'd also like to mention that it was very interesting trying to manage my sugar with an insulin pump in a hospital environment. I think there are a lot of protocols in hospitals about how to manage sugar of patients who are not on insulin pump, but you're kind of like left to your own device when you have an insulin pump and you're in a hospital, and you're not given much instructions. For example, when I went in for my C-section, I was like, where do I keep my insulin pump? Am I allowed to have my insulin pump? Where do I where should the insertion site be? And I had to learn it that day. So I think having giving mothers that information beforehand is great, and I struggle to find that information online or any piece of paper that I was given by the diabetes team.
Yeah, I definitely hear you because like, when we think about like pregnancy and T1D, yeah, sure, a lot of us are thinking about some of the major things related to pregnancy, like, okay, maybe how is my sugar going to affect the baby? What is like the whole course of pregnancy going to look like? But sometimes it's those like nitty-gritty details during pregnancy that are left out, which can have a really big impact on our physical and mental health. Like not knowing what to do with your pump site during a C-section, like I can't imagine how stressful that would have been in the moment and like not being made aware of that prior. So that is like very difficult to hear.
And I think that pregnancy itself is such a, difficult journey. And to do it with diabetes is just kudos to you and all the moms that have a T1D. And I think you really articulated a lot of the challenges, but we also want to know about what we can do, that advocacy aspect, and kind of shift towards maybe some of the work that you've been involved in, or any other resources that you can share with our listeners.
Yeah, so of course we know that there are many advocacy groups out there. For example, Breakthrough Diabetes, like Diabetes Canada, that go and advocate for type 1 diabetes or diabetic people in general in Ottawa. However, I think that everyone with type 1 diabetes can be part of that advocacy. And that can be as simple as reaching out to your MP in your region and talking to them about your diabetes journey and about access and how access was vital to your journey, and what you would like for them to improve on. For example, the Farmer Care Act and how we can expand the scope of Farmer Care Act to include more of those insulin pump supplies. So I encourage people to do that. And your MPs are usually very open to talking to people, to their constituents in the area. So I highly encourage the listeners to try that.
And like for someone who is like looking to advocate at the level you're talking about, like how would you recommend someone reach out to someone working at the policy level? Like what was like if you've done it, how did you go about it?
Yeah, for sure. So if you just Google your MP's name, you can also go on Google and search MP Ottawa, and it will. I'm not sure with the website, the name of the website, but I know you can basically put in your postal code, and it will show you who is your MP, who is elected in your area. So once you click on their name, you can see their contact information, which usually includes a phone number or an email address and or an email address. So you can email them, you can try to call them, but I would definitely try to send an email. I think it's called Our Commons. Yeah, it's called Our Commons. Just let me check. It's ourcommons.ca. And you can basically try to reach out to them and arrange a meeting or send an email with your story. Yeah, I think that's the best way we can try to advocate for type 1 diabetics, and advocate for an improvement in access.
Yeah, those sound like amazing things. Um, are there like specific resources that you like recommend people who are going through pregnancy to look at? Like for example, when you were talking about how there were certain things that your healthcare provider team didn't make you aware about, like for example, your CGM sites or where your pump is gonna go. Like, what are some resources you would tell someone who's pregnant, like, hey, look at so and so things to maybe support your journey during pregnancy?
Yeah, definitely. So when it comes to pregnancy, I highly recommend trying to find a doctor who is affiliated with a hospital that has a prenatal diabetes care team. Um, People who are very knowledgeable about diabetes, and can basically, you can follow up with them. This usually includes an endocrinologist, a dietitian, and a nurse who you can talk to, and they can, if, for example, if you have any emotional issues as well, they can find resources for you. So I highly recommend you find a doctor who's affiliated with a diabetes prenatal care team. I think that really helped me in my journey, and I'm very grateful for them and how they supported me in both my pregnancies. I'm not sure about a comprehensive website where you can find all this information, but there is a group in Montreal that is currently working on a website called Healthy Mom Diabetes. And so, yeah, you can just Google that and you'll find the website. And they're currently basically trying to collect feedback from moms with type 1 diabetes, so they can basically incorporate all that feedback and put all the information that is usually needed in the website. So I think it's being built at the moment. So I encourage anyone who has anything to add to reach out to them and fill out their survey. I think this is it's a wonderful initiative, and it can help many mothers, for many many years. But what I found also useful is just going on YouTube and trying to basically find videos of other moms who have type 1 diabetes, and sharing their experiences, and sharing, for example, their experiences in the hospital, their experiences with their pregnancies, with their diet. um, um, it helped me feel that I'm not alone, and that also hearing their tips and tricks. So yeah, there's, as I said, there's not a lot I feel like that's available out there, in terms of like books or brochures, from healthcare teams, specifically about type 1 diabetes and pregnancy, from trying to get pregnant until postpartum. But there are efforts, and yeah, Healthy Mom Diabetes is one of them, so you can check them out.
Yeah, I love hearing when people say like hearing someone else's lived experiences is such like makes such a great big impact on them because a lot of times when we think about like medicine, we think only biology, chemistry, like very nitty-gritty aspects of healthcare, but like hearing someone talk can be just as impactful as a medication. And so like for all our listeners out there, like finding resources could be something like talking to someone who has been through the experience. So like Rukia, you being on this podcast is especially helpful to anyone that is going through something similar or just wants to be a little bit more informed about pregnancy and T1D. And also for our listeners, some of the websites that Rukia has mentioned, they will be linked below. So don't worry, we'll have those for you.
And I gotta jump in and ask because this has been bothering me. You said that you struggled with where to put your pump during your C-section. Where did you put it?
So I ended up putting it in my on my arm. Yeah, so I put it in my arm, and I bought this like band that I can wrap around my arm, and I put the insulin pump in my arm. Yeah. And I just let the anesthesia team that I have an insulin pump before. I didn't know even like how to, like I was like, okay, I guess I have to tell someone that I have an insulin pump. I was like, okay, I have one here. Like no one asked, but I was like, okay, I have it right. It's right here. Just FYI. But yeah, they were great. They're very friendly, and I'm very grateful for the care that I had at the hospital.
And these are exactly the kind of tidbits, right, that you can get from maybe some of these resources or even the ones that are coming up. So really appreciate you sharing that. Before we wrap up, is there, one takeaway that you could give to our listeners that they can leave with? Um,
Yeah, absolutely. I think if I can deliver one message to the listeners, I would say that for pregnant women with type 1 diabetes, access to an insulin pump and a CGM can significantly reduce the risk of complication. So this technology shouldn't be optional, it should be essential. And access to it is critical for both mom and baby.
That's amazing. Thank you so much for sharing that. Rukia, thank you so much for joining us today, and thank you so much for sharing your lived experiences because we know how powerful that can be for our T1D community and just the general community. With knowledge, support, and resilience, like we're hoping like a lot of pregnancies coming up can be, more supported and like T1D mothers or people going through pregnancy can be better supported. So thank you so much for sharing all the knowledge that you have.
Thank you so much for having me.
all right, that's all for this episode of Diabuddy Dialogue. We'll see you next time. And remember, whoever you are and wherever you're tuning in from, you've got a Diabuddy here.